Okay, good afternoon, everyone. I'm Jo Bibby. I'm the Director of Health at the Health Foundation. And so welcome to our webinar, Exploring the Link Between Job Quality and Health. This session forms part of the Health Foundation's Commission for Healthier Working Lives. We launched the commission in January this year, looking at the factors behind the growing ill health of the working age population, both people in and out of the workforce, and focusing on the policy solutions that we need to address this. We know that being in employment is generally good for people's health and well-being, but not everybody experiences these opportunities equally, in part because job opportunities aren't necessarily the same across the country, but also because of the quality of the work matters too. Good work can provide us with control and security, with income and support, and these are key building blocks of a healthy life. But insecure work or low quality jobs can harm our health. Today, I think a lot of this discussion we've seen has been about the people who are economically inactive in our society. But actually, the work we're doing is showing that there's 3.7 million people who are in employment, but with a work-limiting health condition. And this underlines the importance of work being supportive of our health needs. And this webinar, therefore, is going to focus on job quality, and in many respects couldn't be better timed because we've got a new government which is going to be looking at substantial reforms to workers' rights, and it's an opportunity really to think about that in the round and what's needed to improve the nation's health. So I'm really pleased to just introduce the lineup we have for this webinar. We have Tony Wilson from the Institute of Employment Studies, who's going to start with a presentation on some of the research they're doing for the Commission for Healthier Working Lives on job quality and health. We're also joined by Matthew Taylor from the NHS Confederation, who was a former advisor to Tony Blair and in 2017 led the review on modern working practices. Nicola Smith leads employment rights and economic and social policies at the Trade Union Congress and is also, we're pleased, a commissioner on our Commission for Healthier Working Lives. And Dr. Zubaydah Haque is bringing a range of experience, including from her current role at the Women's Budget Group and other roles at the Equality Trust and the Runnymede Trust. So just before I hand over to Tony, a few sort of housekeeping points just to share. The first is this webinar is being recorded, which means that a video will be available shortly on our website within a day or so, and there will be a subtitled version available too. We do want to make this participative, and there's a Q&A function. So if you have questions as you're hearing the speakers and discussion, please put your questions in the chat. People have the opportunity to upvote those questions, and when we open up for the wider discussion, we'll be taking questions from there. We also, if there's people in the room, in watching who want to add their thoughts on any of the questions and bring some of their expertise in, please do. And also some of my colleagues are on the line and will also answer any technical questions as we go along. If you are using social media, we have a hashtag for our work, which is hashtag Healthier Working Lives. So please do use that if you're tweeting. And I'm now going to hand over to Tony, who, as I say, is going to sort of set us off with an overview of the research he's been doing. And just to assure you, the slides will be available in full as well after the presentation. So there's a lot in them, I know, so don't feel you need to be scribbling lots of notes. They will be available. Okay, Tony, I'll hand over to you now.
Brilliant. Thanks, Jo. And thank you, everybody, for joining. I'm really pleased to be here. So I'm going to be talking about the work we have been doing with the Health Foundation, for the Health Foundation, as part of the Commission on Healthier Working Lives. We've been working with the Learning and Work Institute and the Royal Society for Public Health to provide kind of research and analytical support in the development of the Commission. I said here, implications for policy and practice. So I would just say at the outset, a slight warning, I suppose, that we've been mainly focused, because the Commission is mainly focused on kind of how we can improve policy in the coming few years, and then try to advocate for better workplace practices. I've talked less about, for those of you who work in human resource management practice or in leadership of organisations, I've talked less about the implications for an organisational level in this presentation, partly as well because of time constraints. But that is an area where we also do a lot of work and have views. But I will not. Perhaps we can pick that up in conversation. I'll mainly be focusing here on what the evidence is telling us and what it means for kind of future public policy across a range of areas in the coming years. So, first point, there's sort of three sort of linked priorities here around work and health. I think. The first is around ensuring that work is protective of health. For most of us, most of the time, work is good for our health. It gives us meaning, gives us purpose, gives us income. We generally work in secure work. It's not perfect, but well-being at work is a key sort of driver of well-being for all of us in our lives. The second point now is around rehabilitation at work. So where people develop health conditions or impairments, how we can better support people to stay in work and then actually to thrive at work, making sure that work's part of a recovery, something we can look forward to as we recover, rather than we might fear while we're off work. And then the third, critical area is around access to work where you have long-term health conditions or an impairment. And Joe has already set the scene about why it has become such an important priority. But the really important point to note here, I think, is that good work is fundamental in all three of those, but often in slightly different ways. So, when we think about good work, and when we think about well-being at work, we can sometimes think about well-being strategies and wellness initiatives and well-being support. But actually, the things that keep us well are things like security at work, good relationships in our workplaces, control at work, flexibility, the right sorts of flexibility in how we work, having a purpose, having a voice at work, and of course, having secure income. And really importantly, this means you're less likely to leave a good job if you've got ill health than you would be if you were in a poor job, a job you didn't enjoy, weren't satisfied with, and you're more likely to come back to a good job than a poor one, if you like. And a final point, which is not quite a lot, as we've tested some of the findings here with user organisations, with researchers, is that of course for people with health conditions and for disabled people, these issues are often even more important. It's even more important to find the right job, even more important to have flexibility, control, and so on. So we've mainly been focused in our work on the kind of first pillar here about how does work affect our health and how do we make sure work can be supportive of health, but we can talk about the others as we go. Second sort of explanatory point before I dive into the findings or some of the context and findings is this is the framework we've been using. Other people may well recognise this already. Matthew and the Trade Union Congress and many others, Royal Society for Arts, Manufacturing, Commerce, and the RSA and the Carnegie Group have developed this framework, and it's now been used by the CIPD as well, trying to articulate what we mean by good work around 7 broad dimensions, which try to reflect that it's about security, it's about pay, but it's also critically about our psychological well-being and the nature of our work. Now, why does this matter? As Joe said, much more likely now to have a long-term health condition. People are much more likely to have long-term health conditions now than has been the case in the past. So the solid blue line here shows a number of disabled people in the labour who are aged 16 to 64. This is being driven in particular by an older population. But interestingly, up until about 2020, more people with long-term health conditions, I should say the break here is because of a discontinuity in the data. It's a very boring point, but it's basically the data's been reweighted slightly, but the trend is what matters here. But until 2020, rising incidence of ill health was actually being accompanied by more people in work who had long-term health conditions or who were disabled. And since then, however, since 2020, not only have we seen this acceleration in the trend, we've also seen a likelihood of being in work levelling off. This is bad news. This means employment gaps have stopped narrowing, and actually, as this graph shows, employment gaps are widening. So this looks a bit like an elephant, doesn't it? But this is the x-axis here is age, single age between 16 and 74, and then the y-axis going up is the likelihood of being in work. Blue is people who have good or very good health. Yellow is people who have fair, bad, or very bad health. And the dotted line is your likelihood of having a health condition, likelihood of having poor health. So what does this show? It shows that a very large employment gap, 30 percentage points or more, throughout the life course. But actually it widens as you get older, and it widens too at the point, of course, when your likelihood of having a health condition is increasing. From about mid-40s onwards, there's an acceleration in the trend of having a health condition. And this is fundamentally, people, we've got an older population, greater incidence of ill health, lower likelihoods of employment, if anything, appear to be going backwards. And really importantly, this is happening, yes, at a time when the labour market is faring poorly. This shows employment, unemployment, and economic inactivity on the left, the middle, and the right. But unemployment, the middle one, by historic standards, is still pretty low. And so low employment is being driven in particular by higher economic inactivity, not by rising unemployment. We don't have, we're not seeing a kind of a major sort of demand side shock here causing mass unemployment. We're seeing supply side challenges here, not enough people who are in the labour force ready and able to look for work. And if anything, actually, the situation on the demand side is getting worse for other reasons. This shows the likelihood of skills shortage vacancies. Vacancies overall, 900,000 vacancies in the economy. Although they've been falling, they remain well above pre-pandemic levels. 1/3 of all vacancies now, the blue area, on the blue bars, are due to skill shortages, and it's affecting 1 in 10 of all firms. So that's just a little bit about the kind of context, I suppose, and why this matters. And so what we've been exploring is what we then, how work affects health and how we can do things better. So we've been looking at some secondary analysis of survey data, in particular, a really useful survey, the European Working Conditions Survey, and looking at the UK data within that, because it's current, it's very recent data. There's other sort of better UK data sources that are older, but we've used this because it's most recent. It's a good size sample. Then we've also done a rapid evidence review, looking at sort of big reviews, synthesizing findings from reviews around the links between job quality and health, and in particular trying to explore causation. There's a lot of correlations because obviously health is kind of socially determined. There are many social determinants of health related to where you live, your qualifications, your educational experience, related to your income, your housing, so many other factors. And of course, that can all affect the likelihood of being in poor quality work as well. So we've tried to look at studies that have sought to tease out where there's a direct kind of line of causation, where we can see what factors are causing poor health. This sort of runs through, I suppose, some of those correlations. Even when you control for some factors, people whose jobs are at risk are more likely to experience anxiety or exhaustion. People who work on social hours are more likely to feel unwell, to work while they're unwell. People who have difficulty making ends meet are more likely, much more likely if you suffer discrimination, to experience exhaustion and so on. So we've got this range of sort of causations. And when we looked in detail at the UK data from the European Working Conditions Survey, this shows a whole range of factors, a whole range of sort of red areas, sort of warning signs, where people working in different industries are suffering suffering from particular aspects of poor quality work, which we know are associated with a greater likelihood of then having poor health. So on the left here, we've got a list of these indicators around factors that are associated with poor quality health. We tried to simplify them, and then each column is different kind of industries. Broadly, reading from left to right, these are kind of white collar industries on the left, through to kind of blue collar and sort of manual and in some of the cases here, lower skilled industries too, as we move over to the right. First thing that stands out clearly, there's a lot of green on the left and red on the right. Construction, transport and storage, commerce and hospitality in particular, much greater likelihood of being in insecure work, of having risks to your health and safety due to your work, of having experienced discrimination, of having poor support, poor autonomy, having a lack of representation at work. However, even in white-collar roles, particularly in health, we see some really significant warning signs here too, often around physical and emotional burnout. Nearly half of people working in health services, half of people in education experiencing physical and emotional burnout. And then we looked at different demographic groups. You can see how this is clearly affecting some more than others. So people with chronic illnesses are much more likely. So this is the third column along, much more likely to have, to work in unhealthy environments, have tiring positions, work long hours, and so on. Younger people in general face greater risks than older people, but older people, less likely to have access to training, more likely to be experiencing burnout, less likely to report being supported by their managers. So that's some of the sort of correlative evidence, if you like. But where's causation sort of strongest? Well, these are the factors that come out from the evidence review around the things that are most protective of health and most harmful. So workplace relationships, working the hours that you want, having control at work, and sometimes workplace health interventions can be protective of health. But a number of areas that are really obviously and clearly harmful to health: precarious employment, insecure work, atypical hours, long hours, including night shifts in particular, not having the hours you want, and obviously inevitably kind of physical risks and risks of bullying and harassment. Job strain then is a really important area, which I don't talk about in a huge amount of detail presentation, but is worth returning to. Job strain is where kind of demands and resources at work are out of whack. So where you've got excessive demands but insufficient resources to deal with those. And yeah, particularly challenging. And so the sort of the causation, the evidence around causation suggests, precarious employment, is being driven by, as one would expect, job uncertainty, risks of redundancy and restructure, for example, uncertainty around future hours and so on, and leads to higher risks of depression, anxiety, exhaustion, and poorer life satisfaction. Long hours and mismatches around hours as well, significant risks. Whereas good workplace relationships are very protective of health and particularly protective of mental health, even when controlling for a range of other factors. Importantly, as I mentioned, people with long-term health conditions much more likely to be at risk when these things aren't in place. So the final point I'm going to make, though, is just around then what's this mean for sort of public policy and workplace practice. So here we've been looking at different examples and approaches in the UK and internationally. And I think there's broadly 4 ways, this is adapted and developed from a framework that the OECD have developed, there's broadly 4 ways that we can affect practice, that policy can sort of make a difference, if you like. Firstly is around setting clear standards, employment legislation, the enforcement of those rights, workplace or collective agreements, and to some extent, accreditation schemes, awards, and standards. Secondly, is having clear financial incentives and penalties through social insurance for occupational health and so on, or through how we commission. Thirdly, is then through the direct provision of advice, guidance, or information, and that could be provision of employment support services, of occupational health services, of workplace wellbeing, or provision of advice and support to firms on just how to manage workplaces better, or how to plan effectively, how to line manage, how to support people. And the last point is kind of direct delivery of public services, health services being the kind of key example of this, but active labour market policies being important too. And what we found is that kind of the key sort of enablers of change, the key things that appear to make a difference, where you've got a really clear and a sharper sharing of financial incentives and costs, as you'd expect, between employers and government, where you can articulate clearly the business benefits for action. There's a clear purpose for it, and that we can make that clear, and businesses feel able to act on it. Greater transparency makes a difference. We can certainly learn a lot from this, from examples we've seen in the UK as well around trying to be more transparent. Everything from food standards, kitchen hygiene to gender pay reporting. A clear and simple legislative, or simple is probably the wrong word, but a clear legislative framework with straightforward enforcement, unified enforcement. The institutional capacity to do this, and that's been a key challenge here, running this down, and then kind of public sector buy-in, leading by example, doing more of this ourselves. So final point, how are we doing at the moment? Well, it could be better. Clearly, it could be better. But there are things we can build on. So the UK is a very light and even legislative framework, and we're now going to be having one of those periodic debates like we had in 2017, and before that we had in 2012, had from time to time, about where you strike the balance on legislation. But while I think the New Deal for Working People is really welcome, really positive, and will be transformational, I think we do need to consider what the active policies are that support this raising of the minimum standards, which will lift many people out of poor and insecure work. But how we then try and go beyond that and work with employers to get beyond that through enforcement, but also through better engagement with firms. We've got quite limited scope around financial incentives and penalties, mainly because of the design of our social insurance system, and that dates back nearly 100 years now. But I think there are clearly things we can do around more targeted incentives, where we can make these work, and probably certainly through social value and recruitment. Where I think there's more significant gaps, though, where things can be patchy, but also where there's opportunities, I think, is around how we provide business support and services, information, advice, and guidance for firms. I actually think the government's initiatives, announcements around a new jobs and careers service are potentially really welcome here, if we can find ways to better engage employers too. But we have a particular gap in how we reach employers, and small employers especially, with straightforward advice and support on just HR management practice and supporting developing staff. And last point, for all of you who are NHS leaders or NHS managers, the things we can build on in the NHS, particularly through the development of local work and health strategies that the integrated care systems are taking forward, but also I think around what we all can do in trying to make work better, more rewarding, more secure, better support people at work, improve workplace relationships, and address some of those underlying drivers of decent work too. And critically, that will be in the future much more dependent on how we work in partnership with others as part of local networks and communities. And I believe the ICSs are going to be able to take a lead on that. I hope that's my last slide. Not quite. Yeah, okay. These are these points already, so that's good. So I think a better model, public service delivery. Keen to sort of hear your views and what that would look like and how we can do it. Thank you very much.
Great, thank you for that, Tony. A lot there, and I think really paints the sort of size of the challenge that we're facing in terms of working age health, but some really concrete things around areas where solutions may lay. So I'm going to now turn to our panel, starting with Zubaida, to provide sort of reflections, around 3 minutes reflections on Tony's talk and the sort of wider context we're in. So over to you, Zubaida.
Thanks, Jo. And thank you, Tony. That's going to be a hard act to follow, by the way. So thank you. You covered a lot there. A lot was packed in. So I'm going to try and just address, just have reflections on some of it, because it's going to be too much to cover. First of all, I guess I want to start with the pandemic. And the reason I want to start with the pandemic is this, which is one of the biggest lessons we learned in the pandemic is it's not health versus economy. It's health and economy. And that's a really important point to keep in mind, because it's, sorry, I'm suddenly I'm echoing. Am I echoing on your side? No? Okay. So it's a really important point to keep in mind that it's health and economy. So I welcome this discussion. Secondly, obviously, job quality matters. It's really important. But I think there's a couple of things that we need to keep in mind. What I really liked about Tony's slides is he illustrated very clearly that it's not the same for everybody. We know that issues like low pay, insecure work, 0-hour contracts, poor and inadequately monitored progression, racial discrimination, gender discrimination, disability discrimination, sick pay issues, pregnancy, maternity pay, and so on and so on. We know that those things are taking place in the labour market. They've been taking place for a long time in the labour market, those practices, those poor practices, those poorer working conditions, by the way, some of which not just affect men and women, Black and ethnic minority groups and disabled groups, but also migrants. We very rarely talk about migrants. Migrants with no recourse to public funds, they matter, and they matter because the link here between all the other groups that are not protected in the labour market is this, which is around agency. We often talk in terms of the labour market, in terms of the gap between policy and practice, in terms of what employers can do, in terms of legislation. We rarely talk about agency in terms of what can the individual do, what capacity, what power do they have to challenge poorer practices. And that really matters. My third point, I suppose, is around this, which is this perhaps a bit more of a controversial point, which is the other thing the pandemic illustrated very starkly, is that the unit of interest shouldn't be the labour market. The unit of interest should not be the economy. The unit of interest is us. And what it should be is a labour market and an economy that works around us. Part of the reason employers haven't got better and better. It's always, I mean, they're always improving, but it's patchy. We've got good practices and poor practices, but we've got issues like racial discrimination and gender discrimination, disability discrimination that are still persisting decades onwards despite legislation. Part of the reason for that is because the economic case doesn't work. It's because the business case doesn't work. It's because legislation doesn't work. And it's also because the employer, the worker, is seen as isolated, as an isolated unit from the rest of their lives. And in terms of the economically inactive, that matters enormously. We need to consider the context of people's lives in order to do something better for them. I'll stop there, Jo, because I can see Jo's looking at me, but I'll just park it there. Thank you.
Great. Thank you very much. Some really interesting points there, which I think are going to probably also resonate with some of our subsequent speakers. But I'm going to hand over to Matthew now for his initial reflections.
Thanks, Jo, and thanks, Tony, for a great presentation. Look, I'm just going to make 2 points really about the opportunity that I think now exists. So I think Tony has vividly described some of the challenges, some of the problems. But, we are at a particular moment with a new government putting a lot of emphasis on the relationship between health and work and the economy. And so I think that there are two things that really excite me. The first is that when I wrote my report for Theresa May back in 2017, partly what I wanted to address was the fact that the issue of the quantity of work was recognised as an important public policy consideration, but there had never been anything like the same recognition of the importance of quality of work. So there was no way in which government was held to account. It didn't measure the quality of work. It wasn't held to account for the quality of work. It didn't have quality of work objectives. So that dichotomy between how many jobs we got, how many people are unemployed, the things which we kind of hear about every month and that are measured all the time, come to the forefront when unemployment rises in particular, and this lack of focus, accountability, and data on quality of work. I'm excited by the focus on health and work that we see in government policy, because it seems to me to be an opportunity to overcome that dichotomy. Because for the reasons that Tony eloquently described, the relationship between health and work is one that is both quantitative and qualitative, and they cannot be untangled from each other. Part of the reason why we have too many people out of work who could work for health and care related reasons is to do with the quality of work that is available. So that's the first opportunity, I think, to make sure that those two debates are entwined. We consider these issues together and recognise not the other thing that I wanted to do back in 2017 was to completely refute the idea there was some kind of trade-off, that if you focused on quality of work, you were somehow risking a lack of focus on quantity of work, that if you improve the quality of work, it would somehow reduce the amount of work. So I think we've turned that apparent kind of zero sum into more of a discourse about synergy. That's the first point. The second point is even easier to make, and that is that within local economies, we have in the past had a dichotomy between the fact that the health and care, and I want to emphasize care, although the NHS Confederation isn't responsible for care, but we have a dichotomy between the health and care system as a major employer and the impact of the quality of work on the NHS and care system. And again, I think through integrated care systems, working now with local authorities empowered to be more proactive and joined up in this space, I think there's a real opportunity to consider quantity and quality of work issues in a local context in ways that both recognise the importance of health and care as employers and the role that health and care organisations can play in providing quality work, but also recognising more directly the impact on the health and care system of the quantity and quality of work that exists in the local economy. So I think these are two really kind of difficult dichotomies, separations and gaps that have existed in the past. And I think in both domains now, there's a real opportunity for synergy.
Great, thank you, Matthew. So good to see questions in the chat, and a reminder, please upvote questions if you're particularly interested in the answers, but I'll hand over to Nicola now for her reflections.
So much, and I couldn't agree more what an exciting time it is for those of us that care about the quality of work and opportunities to improve people's working lives. And I was looking back before this webinar at the last time we were able to properly have a conversation that focused on the quality of work and its impact for people's lives and its impact for health. And my lodestar on this is the Marmot Review, which was published back in 2010. I think probably commissioned towards the end of the last Labour government, if I recall correctly. And in that report, there was proper formal recognition from the government, I think for one of the first times, that insufficient insecure and poor quality employment is associated with risks of poor physical and mental health, and that these are factors that have biological effects, factors like the status someone has at work, the amount of control and support they have, and relate to risk of health. So we had that conclusion back in 2010 that actually work first isn't always best, that quality of work matters, that there is this strong relationship between the quality of work that people have and our national economic outcomes. And yet for the last 14 years, zero progress, despite various periods when words were warmer than others about the need for action. And over that time, we have seen changes in the jobs market. So a rise in new forms of highly precarious work, introduction of new technologies that have enabled new ways of working that can put people's health at risk. And there hasn't been a proportionate or regulatory response given those trends, and there hasn't been any improvement in enforcement as in response to those challenges. So absolutely, I would agree with Tony. Good work is great for health. It is good jobs are a really important part of enabling people to live good and healthy lives and to make a full economic contribution. But I also very much welcome the government's current recognition that making work pay is a crucial part of what their economy mission is going to seek to achieve, and that ensuring that we've got good jobs where the people doing them are able to improve their health and their living standards and their well-being is the best way to build a healthy, productive, strong economy for all of us. And I suppose I would just, one point I would make in direct response to Tony is that this has to go two ways, right? So yes, I agree there are big supply side challenges in the jobs market at the moment, but I also think we've had a big problem of demand. And if you look back over the last period of time, unemployment has been lower than you might have expected during periods of low economic growth. But bad quality work and massive falls in real wages have been the challenge of our age, right? The scale of the living standards squeeze has been evident to everybody. It's not finished yet, and there's been years of falling real pay, and some of that is poor growth and poor growth outcomes showing up in people's pockets. So equally, the strong growth that we hear the government now talk about really matters, because you need that demand to enable the stronger jobs growth, to enable those rewards to come, and then you need the regulatory framework to ensure that they're fairly shared. I'm conscious of time. I wanted to say a very small bit about the actual New Deal and the legislation. I'll be very brief, and maybe we can get more into this in the Q&A. But I suppose my top line view would be absolutely regulation alone is not enough, but it is essential. It sets the floor, it sets the standard, it sets the culture, it sets government ambition for the sorts of public sector employment practices that others have talked about on the panel, and it has to change and it has to improve. And we have already started to see, although we see many employers and employers' bodies come out and recognise at a top level that good quality, secure work is a shared aim, we are also starting to see the backlash. I can maybe talk more about this in the questions, but even this weekend in The Sun, we heard there was an article setting out all of the supposed business burdens that were now going to destroy growth across the economy, including, for example, giving people access to sick pay from their first day of being sick rather than the fourth day of being sick, or ensuring that people who are paid less than £123 a week have any access to sick pay at all. These are examples of the most limited improvements you can imagine in sick pay entitlement. They would leave us still well below the replacement rate of many other European countries. And without going into detail across the whole range of policies, which I could easily take the rest of the webinar to do, I think the challenge of this sort of approach on all of us is to really push back and to say, we have to move beyond this now. It's time to move beyond this idea of some binary opposition between, what's in workers' interests and what's in business interests, between setting this up as a big red tape burden. That is a narrative and an approach that has been entirely disproven by the evidence. The OECD show very strongly that the work of decent employment protection and strong growing economies go strongly together. And I think there is a huge opportunity now to achieve change in the UK jobs market, but also a huge responsibility on all of us that care about achieving that change to push back against these narratives that set to set to present these changes as in some way an impediment to the economy when we know that they will bring a net benefit. Thanks.
Great, thank you, Nicola. So I'm going to just go around and put a few specific questions to the panel, and then we're going to move on to the Q&A. So thank you for those questions that are still coming in. Matthew, I was just going to start with you, because you finished by kind of saying how that link needed to be made between what the NHS could do and social care could do as an employer to deliver benefits to health, and recognising that some of the health challenges people turn up into the healthcare system for are driven by aspects of poor quality work. I mean, what would your assessment be? I agree with you. I think that link is being made, and we see it across work of all sorts of organisations talking about the NHS and anchor institutions. But I'm curious as to where you think we're at in terms of the NHS and social care really delivering on the benefits of good employment, and what more needs to be done.
Joe, well, let's start with social care. I think we'd all welcome the commitment that was in the King's speech to improve the quality of social care work, social care employment. And I'd commend a very good paper that the Nuffield Trust published a few days ago on the ways in which you can go about that. Because clearly, although there are many challenges with the quality of people's working lives in the NHS, which I'll mention in a moment, social care is in a much worse position because it is much more casualised, much more atomised. There are very, very few people and very few incidences, for example, of people not being paid the national minimum wage in the health service, but many in social care. So that's good. I would only say, however, in brackets, that there is something almost surreal about the debate we're having around social care, because everybody's in favour of doing things that will improve it and will cost money, but nobody seems to want to talk about how it is you pay for those things, whether it's greater investment in social care, whether it's a cap, which is supposed to be introduced next year, whether it's improvements to the workforce, the big question. And I'm not encouraged by the idea this might be batted out to a royal commission, because, why on earth do we need another royal commission to examine these issues? But that's a priority, clearly, and some kind of much stronger national framework for social care employment is urgently needed. In terms of the health service, it's a complex picture. We often hear stories about people in the health service suffering from all sorts of kind of problems, and I found it very interesting in Tony's slides that one of the highest kind of red boxes was for burnout of health staff. I think it was kind of one of the 3 or 4 highest kind of negative scores, as it were. It is clearly, that is, in my view, clearly the biggest issue for the health service. Of course, we don't pay as much as we would like to pay. And Wes Streeting and Rachel Reeves having to address those issues kind of almost as we speak. And there are things we can do to address the conditions of people's employment, rest spaces, and a broader commitment to well-being. And there are clearly major differences as well. When you look at the staff survey, you can see that, some organisations are pretty good at engaging and giving their staff a good experience of work. Others are really not nearly so good. And as I go around visiting health service leaders, as I do on a very regular basis, I can see those who absolutely put staff engagement at the very top of their strategy for improvement, and those who would recognise it but aren't talking about it as being as central. So staff burnout, overwork, I think, is the kind of critical issue in the health service. And I would connect to that, Joe, a sense of futility, actually, a sense that what we're doing in the health service is trying to meet an unstoppable demand in a way that doesn't meet the reasons why people came in to work in health and care. They came in to work in health and care to look after people, and they find themselves in a situation where they're constantly kind of just managing what feels like a kind of never-ending crisis. And so there is a real need to reimagine the way in which we provide health, because one of the things that will give people in the health service a sense of hope, despite the enormous challenges of their work, will be a sense that we are unraveling some of the problems about our unsustainable health model. And then the final point, Joe, I'd make, which I've kind of referred to a bit, but I do think is important in this discussion, is quality of management. This is a major issue. And I think when I looked at work, a few years ago, a whole number of other people, quality of management is a really, really important variable. But because it's kind of difficult, it's not randomly distributed, but because it's quite a kind of complex phenomenon, how do we understand quality of management? We don't talk about it as much as we should. But clearly, for me, it is an issue. And of course, in the NHS, if you want cheap headlines, you just attack managers. But actually, we are undermanaged in the health service. And I think one of the reasons why people's working lives aren't as good as we would like them to be is because we don't sort out systems that are not human friendly, that are not well designed. I spend a lot of time talking to people in the health service who are deeply frustrated about the way in which things work or don't work. And so quality of management also is an issue in the health service.
Right, thank you, Matthew. So, Zubaida, I wanted to turn to you, and one of the things that you said that really struck me actually, and in a way I haven't heard articulated quite as clearly as you did, was the whole point about people's agency, their individual agency, their ability to challenge, their ability to make sure, even when the kind of rights are there, that they are benefiting from those rights. So I wondered if you could perhaps just expand on that in terms of people who are working with poor health. What more could be being done by employers to issure that, they are helping people act on that build that agency and act on it?
Yeah. Well, but it's a huge issue, isn't it? And I think it explains, Matthew's excellent report wasn't the first report that looked at what's happening in the workplace, whether it's discrimination, whether it's zero-hour contracts, insecurity, gender harassment issues and so on. There have been so many reports and there have been so many recommendations. It's not a lack of employers. It's not a lack of resources out there for employers, although of course we can do things much better in terms of guidance. It is about the gap between policy and practice, and that's where agency does come in, because Matthew talked earlier about how in the NHS they're trying to do things better in terms of recognizing burnout, in terms of practice and so on. But I think what's really clear is when it comes to poorer practices, when it comes to poorer conditions in work, it's not just an issue about it affecting everybody and making everybody's lives a little bit poorer. It's the fact that it has a disproportionate impact on some groups more than others. And of course, we saw that in the NHS at the beginning of the pandemic, when a disproportionate number of Black and ethnic minority professionals within the NHS were dying. The first 10 doctors, I think, were Black and ethnic minority. We know that, of course, it was that subsequently in the pandemic that was still happening. So we know that there are issues around disproportionality within the workplace in terms of its impact. And the reason I mentioned that is you have to recognize that. You have to recognize that in terms of addressing it as an employer. And it goes back to me saying you have to recognize the unit of interest is not the worker, it's the individual. Now, linked to that is the issue of a lot of the issues around workers being poorly affected, being in poorer conditions, is around gender as well. Gender is a huge issue around it. And unless we look at some of these issues through a gender lens, we're not going to address it. So, for instance, we know that there are 5 million workers in this country who are carers. 3 million of those are women. We know that among those who don't get sick pay, the majority of those are women. No matter which way you look at it, in terms of poorer practice, women tend to get hit harder. In terms of economically inactive, more women are economically inactive due to long-term ill health than men. Now, we can't ignore that. That's not just a separate inequality or gender equality issue. That is core to what's going on. So I think employers need to do that. And in terms of what employers can do, I think, yes, Nicola, you articulated really well. And I think you're right to say this, that legislation does matter. We do need standards, absolutely, and especially around sick pay. But the reason I don't think it's enough it's because of that gap between policy and practice. And I think a lot more can be done around transparency. Tony mentioned that, transparency of performance. Progression is one of those areas where performance and transparency is just so, is so opaque. And yet it disproportionately, the people who are worse off are Black and ethnic minority groups, disabled people, and women. I'll park it there. There's a lot more to say around that in terms of what more we can do, but I don't want to let others come in as well.
Great, thank you. So, Nicola, just sort of final question for you before we go into the ones in the Q&A. I mean, you talked about this being an opportunity to do something. It'd be good to know, do you feel that what's on the table at the moment with the current government is enough in your view? Would you want to be seeing more? And what role do you think the unions have to play in progressing this agenda?
Thanks, Jo. Well, yes, I think it's an ambitious and a welcome package. And I think it's a package from a government that's serious about improving living standards and improving growth. And I think that the really important thing about the whole package of measures set out in the Making Work Pay manifesto is that they're measures that reinforce each other to both set a fairer regulatory floor for employment standards, but also to encourage those sorts of culture changes in practice that will be so important to making sure that these rights are real and are realised and are not paper rights that nobody can enforce properly. So, for example, there are provisions there which I think will be brought forward possibly through the Race and Disability Act to introduce race and ethnicity pay gap reporting. Now, we know from gender pay gap reporting that on its own doesn't make huge change, but if you were to introduce action plans alongside pay gap reporting as you bring a culture of transparency to corporate cultures and to the realities of race and disability discrimination within companies, you start to drive change and you start to embed better, fairer working practices. Similarly, when you look at what's committed to for a fair pay agreement in social care, the potential direction of travel that leads you in is to both have an honest discussion about the scale of the challenges in health and social care to make sure that as a minimum, the minimum wage requirements for social care workers, for example, on travel time are being enforced, that there are career pathways for social care workers in the future. And that moves you towards an ambition of, a clearer set of working standards for professionals in social care where they can progress in the same way that professionals across the NHS can. So it takes you in the direction of something very ambitious in terms of driving up terms and conditions and changes in ways of working. Similarly, around procurement, if we can get to a point where a vast majority of government procurement and public sector practice is reinforcing good working practices rather than enabling a race to the bottom on terms and conditions as part of a money saving exercise, that will be very positive, I think, in terms of the sorts of jobs and the sorts of ways of working that government seeks to embed. Also, you can't underestimate the impact of a provision like banning 0 hours contracts. And, what does that actually mean for someone at the moment who is not got a single piece of paper or any guarantee at all of having any work tomorrow, who may have been working for years, a relatively regular series of hours, 20, 30 hours a week, but could wake up tomorrow with no notice, no redundancy pay, and find that their employers just decided to take their work away. Someone who every night goes to bed not knowing if they're going to get a text message saying you have to come into work tomorrow or there won't be any more shifts. Giving people the right to say, it will now be a requirement that you will have a right to a contract which reflects your regular hours over the last 12 weeks and reasonable notice of shifts and compensation if they're cancelled at short notice is pretty transformative for people who are in the very most precarious jobs where the health impacts are likely to be the worst and where there is effectively ways of working and conditions going on that just shouldn't be acceptable in a modern economy at the moment. So I think it's the breadth of the package and the ambitions and the way that the different measures have potential to reinforce each other to move in a more positive direction of travel. And that includes measures which will support trade union organisation and make it easier for unions to organise and recognise that in well unionised workplaces, you have improved health and safety, improved productivity, improved opportunities to make sure that where there are failures of employment rights or treatment at work, that those are addressed constructively and quickly with managers rather than left to fester. So taken together, you know, I'm very optimistic about the package. We're a long way from having achieved it, you know, but the bill has been announced. The government has announced that legislation will be brought forward within 100 days. And, you know, we really look forward to seeing the debates and the ambitions turn from, you know, commitments into practice.
Right, thank you, Nicola. Okay, I've been looking through the questions in the Q&A. There's a lot there, and Tony also has sort of very kindly been answering some of them. But I'm going to pull a few of those out now, just to have some discussion around. One of the ones, Matthew, I thought I'd put to you was around the role of the health and safety executive. And is this something you've got thoughts on how the health and safety executive can take a more active role in thinking about health in this broader sense?
Not specifically, Joe. The only thing I would say is I'm sure that the HSE, like other important agencies, like ACAS, like the enforcement agencies, did suffer from substantial cuts to their capacity over the last few years. And I think part of what we have to do, of course, you know, there are extremely tight limits to public spending, but we have to recognise that when you take the capacity out of those kinds of organizations, it often leaves them in a kind of very reactive mode rather than being able to be more proactive and more strategic. So I'm not going to pretend I have more insight than I do, only to say that when I was, for a brief time, Director of Labour Market Enforcement for the government, this issue of the kind of capacity of these agencies either trying to address harms or to promote good practice, you could see how challenging it was for them meeting the need that existed out there.
Yeah, no, that's really valid observation, isn't it? If there's no capacity there, it's hard to do the role. Another question that has come up is around understanding the impact of neurodiversity in the workplace and creating neurodiverse environments. Tony, I know you've actually answered this in the chat, but I just thought this was a question that was worth perhaps bringing out. Would you like to share your reflections, and if anybody else wants to come in on that?
No, look, I agree. It's definitely it's definitely worth a wider discussion. So we've seen, so that's right. So we've seen a far greater sort of focus on neurodiversity in recent years. I think a greater, and there can be a tendency that this is sort of characterised as this is sort of young people being diagnosed neurodiverse. I mean, it's with autism or neurospectrum sort of conditions, and actually it's happening, I think, across age groups. People with young and old, realising it, and a greater societal recognition around neurodiversity, and realising that they are neurodiverse, and there are ways that the workforce that they might be able to be better supported in work. So there was a review of the Government Commission back in February, which was looking to sort of look at things we can do to sort of raise awareness, reduce stigma, better support autistic people to return to work, improve recruitment practices, support people in work, and so on. But I think there is more that we can do, and I think in particular there is a kind of one area we've been looking at specifically is around how we can make employment services more inclusive and better supportive of people who are neurodiverse. And so I did put in the chat a link to a report we published on that, which is looking at the Restart scheme and how to improve that. I don't have answers on that really, just I think it's one of those, it's an important area where we need to be sort of consciously thinking about how we can make services more accessible and more sort of tailored.
Thank you. Matthew, do you want to come in on this?
I mean, look, I hesitate before saying this, but at risk of being controversial, but on this issue of neurodiversity, I guess what I want to say is that, and I say this as an employer, is that it's really important and a really progressive change that we've recognised neurodiversity, and that it's something that we talk about in the workplace, and it's something that we have destigmatised to some extent at least. However, I do worry that sometimes the route of kind of individual redress in the workplace needs to be balanced by a focus on the overall culture of the workplace, so that part of how we make sure we have inclusive workplaces is to recognise the specific needs of specific people. And, I think, 70% of the workforce have a protected characteristic. And that's entirely appropriate. But it's also really important, I think, to talk about the overall culture of the workplace, such as everybody, whatever their needs, whatever's going on. For example, people may not be neurodiverse, but they may have real challenges in their family lives or whatever, that we have workplaces which, recognise that people have different needs, different strengths, and seeks to enable people to bring their best selves to work. So absolutely, this is really important. But I think a workplace that is great in terms of people who are neurodiverse is partly one that recognises individual characteristics and makes responses to that. But it's also one that just recognises the plurality of people's strengths, weaknesses, and needs.
All right, Zubaida, you want to come in?
Yeah. So Matthew, can I just pursue this point a bit further with you? I suppose, because I'm trying to understand exactly what you're sharing here. I completely hear you in terms of, we've got to balance individuality, individual needs versus workplace culture. I would argue that they're not distinct, that actually a good workplace culture does take into account different needs. I think the important thing is its needs are not all the same. Needs are not all the same. Characteristics are on a different plane to someone saying, well, I can't work these hours because I've got other commitments. Unpaid carers or carers, their needs are fundamental, because it goes back to this issue about, we can't separate our work lives from our home lives. We know that from the pandemic, that you can't separate the two. And it shouldn't be that way. You should have a labour market that works around the individual and recognises what the individual is bringing to the table. And at the same time, when it comes to personal characteristics, the reason personal characteristics matter, the reason they're protected, many of them, under the Equality Act, is because there is unfairness in the workplace. It's because there's discrimination. So it's not the same. There is a hierarchy there that I think needs to be addressed.
Completely agree. And I think the point I'm making, Zubaida, and I'm sorry for not being clear, is that those protections are necessary, but they're not sufficient to a successful workplace. And I think, for example, in the NHS, you may often see organisations that work very hard to ensure that they protect people's rights, and they have a kind of strong regulatory framework, but actually the way people are treating each other day in, day out, the recognition of every human being's need to be able to have a working day which is manageable and not to go home in tears because they've suffered moral injury, there's a universal element to this, as well as the element which recognises the specific and structural nature of inequality and exclusion. That's all I want to say. I want us both to have both those conversations together. That's all.
Right, thank you, Matthew. So a few of the other comments I'm going to pick up. So just to give panelists a bit of a heads up, there's a question around, social protections and whether they're adequate. So Nicola, I'm going to come to you on that one. There's a lot of comments around the management point, which clearly has resonated, Matthew. So I want to come back on that as well. And also, Zubaida, some questions around unpaid carers, which I think kind of has come up on various points here. So I'll come to you on that. And Tony, please do come in, and give us evidence and any insight on any of these things as we go through. But Nicola, just this question of social protections, you talked about some of the comparisons with other European countries and so on. What would you say about whether or not, particularly people with disability, if we have adequate safety nets there, and what more could be done?
I mean, I think probably pretty uncontroversial to say the safety nets aren't adequate at the moment. We are far behind many other countries, and our social security system has undergone a period of quite extensive retrenchment and reduction in generosity under many governments over recent years. Addressing that is going to be a long-term challenge. Everybody knows that it is part of the solution you know, we've seen the debate play out most recently, haven't we, around about the 2-child limit in the benefit system and the very direct impacts that that policy is having for levels of child poverty, which will no doubt be having a direct impact on many children's health and well-being as they grow up. There are many areas across the social security system where absolutely increasing generosity needs to be a government ambition, and I think people are right, that needs to be recognised as part of the debate, because if you leave work to absolute abject poverty and to debt and to worry and distress, your chances of getting better are clearly much more limited. I think I also just wanted to come back very briefly to the enforcement debate and discussion that was happening previously. I think there's a huge amount of work to do here, and it's another area of social policy where for years we just haven't had any sort of informed focus on what is needed. But the question of whether HSE should be integrated to a single enforcement agency, I think, is almost secondary to a question of, what are the existing enforcement agencies we have? We've got one for minimum wage, we've got nothing for holiday pay, we've got gaps around about various other aspects of employment rights, we've got hardly anybody enforcing employment agency standards, even though we've got lots of people enforcing minimum wage enforcement, hundreds of thousands of people, thousands, I think, are underpaid minimum wage every year. There isn't the right information sharing arrangements between different agencies, and where the backstop is the tribunal system, the current backlog means that it's falling over and it's not working effectively to do the job it's meant to. So I think there is a huge need to identify the full range of challenges facing the system of enforcement of employment rights. Individual enforcement of employment rights is never going to be sufficient. You need to have trade unions and organised workplaces and collective enforcement to sit alongside individual enforcement routes. But there's a lot to discuss and debate and to think through in terms of what is needed and the various changes, both in ways of working and resourcing and workplace organisation, that are needed to make sure these rights become a reality. So I think it's a really important area, and it merits, a lot more time and focus than it has had over recent years spent on it.
Right, thank you, Nicola. Yeah, Matthew, if I could turn to you then on the management point and the importance of quality of management. So, I mean, I think that has clearly resonated with people, and we know it's necessary to get the outcomes we want. What can be done? Given, as you said, it's one of those things that's, it happens everywhere, every day, all the time. It's not something that's easy to get our hands around. What could we practically do to improve quality of management?
We have to take it seriously for a start, and we have to stop denigrating managers as if, as it were, all they do is, push bits of paper around their desks or push emails around their network. So, we have to take it seriously and recognise the importance of good quality management to A, productivity, and B, the quality of people's working lives. It's interesting in the health service that sometimes, fairly major shifts are taking place without any real attention to the managerial challenges. So, one really obvious example of this is over recent years, we've seen a significant growth in the primary care team. So, when people talk about primary care, they often, think immediately of GPs, but now primary care networks employ a significant number of other people, whether they're, nurses or physiotherapists or social prescribers or health coordinators. There was really no emphasis at all on organizational development or support for GPs as they took on these very significant managerial roles. And not surprisingly, that's been a challenge, and that's fantastic practice. And I've gone out and seen it, but that's a big shift. GPs are not trained to be people managers, and then they are taking that role on. The other important thing is something that we do well in the health service, to be honest, is that we just measure this stuff. And, I do think, and it was something I talked a little bit about in my report many years ago, that just good quality staff surveys, it sounds incredibly prosaic, but it's very important. My own organisation, the staff survey every year, the in-depth staff survey every year, is not just a kind of opportunity for us to reflect on how we're doing, but it really drives the HR agenda for the next 12 months. And that HR agenda is intimately connected to the corporate agenda. So take management seriously, recognize the importance of management and organizational development when you want change to happen, and make sure that you just talk to your employees on a very, very regular basis so you understand what's going on in your organization and understand where you need to support your managers to do better.
Right, thank you, Matthew. Zubaida, the point about supporting people who are working but have caring responsibilities, what would you like to see being done, both by employers or any action that you'd like to see government setting out?
Well, I think first of all we need to recognise, as I said, that the majority of care. Well, there's a lot of carers that are currently unpaid. Got some 5 million carers, and we know that 75% of unpaid carers do worry about juggling work and home, and I think so. We need a lot more flexibility around that. We also need to recognise that they have poorer mental health because of caring, and once again, this goes back to the issue that an employer can't say, "Look, that's an issue outside of workplace. That's not for me to deal with. That's your issue," and somehow think that that's not something that they have to do something about. If an employer wants a happier, present employee, and the other issue here that we haven't talked about is it's not just about people not coming back to the workplace, economically inactive, not returning to the workplace. We've got to talk about retention as well. So if an employer doesn't want people with caring responsibilities to drop out, they do need to work much more around that. I want to sort of raise a separate point, Joe, if it's all right, just picking up on things that Nicola and Matthew have said around enforcement data and action plans. And also about individuals going back to this issue of agency, individuals having to bring things to the attention of employers, individuals having to hold employers to account. It's always been imbalanced. It's always been imbalanced. You know, whether you look at race discrimination, gender discrimination, employment tribunals, the onus of responsibility has always been placed on the forgive me, my phone, has always been placed on the worker. And I think that needs to change. That needs to change enormously. And I do welcome Labour thinking a bit more about employment tribunals. You know, it is notable that of their 40 bills, about 15 or 17 was on the workplace, and that's great. Now, in terms of enforcement, I do think that's quite important. I think we haven't had, as Nicola rightly pointed out, enforcement. Employers see it as a bad word, and as a result, government actually haven't been as tough as they could be. And bodies like the EHRC don't have sufficient powers to hold employers to account. But we do need enforcement. You know, it goes back to what I was saying. We've had the Equal Pay Act since 1970. We've had race relations legislation since 1965. You know, indirect discrimination since 1976. It's not enough because the enforcement there isn't sufficient. And I want to say a last thing about data, which is, Matthew, I absolutely agree with you that data is really important. Around surveys, there should be a lot more robust monitoring about employees' workplace experiences in order to see what's going on. The problem is data isn't enough. You know, data is really, really important. And the truth is that, as you and I both know, Matthew, having worked in government a lot, which is if you don't have data, then it's as though a problem doesn't exist. And if a problem doesn't exist, you don't have a policy response for it. So data is critical. But this is a point that goes back to something that Nicola said, which is unless you have action plans around transparency of data, but action plans to do something with that data, like the ethnicity pay gap, the gender pay gap, then actually not much happens. So I'm just going to put that.
Thank you. So we've just got a few minutes left. Tony, there were a few questions that came up, and maybe just some very quick reflections on them. A few people were asking about, is there a case for a 4-day week? Would a 4-day week lead to a healthier workforce? Some people asking about universal basic income, and also a few questions around the role of occupational health. So any sort of top of your head thoughts on any or all of those points before we close?
Well, so I worked a 4-day week for quite a long time, best part of 10 years, but I didn't get to keep all my pay. I did it when my little ones were littler. And I think I think there's definitely value in trading off less time at work and more time outside work and trying to protect our incomes too. The point of the 4-day week is, can you do that and still pay yourself the same, still have the same level of output in a firm? Massively challenging, and the answer to that will vary firm to firm and requires a lot of really careful work. But I think some firms have shown that, yes, you can more or less do it. What happens more often when you get into the real detail of what's been happening on these pilots and things is that you just compress work a little bit. Maybe you work a bit longer than 4 days. You squeeze things in, you do less stuff. And I think it's quite hard to get a real meaningful sense of the impact of that over a short period, because actually some of the things you might sacrifice take much longer to manifest. So it isn't really straightforward. One thing I would say is, in France, with limits on working time, that was really positive, led to improvements in well-being overall. But there's also evidence it did lead to problems for some lower paid staff who had less control in their work, particularly part-time workers and particularly women in lower paid work, less access to overtime, less control at work, less choice over the hours that they work, and more directive kind of control from their managers. This was all kind of well evidenced at the time, but this was behind overall improvements in well-being. And actually, well-being on average even improved for many of those groups, but it wouldn't necessarily improve for everyone all the time. So it kind of comes back to the point. There isn't a simple answer on all these things. It is about how do we improve, how do we change kind of culture and practice, how do we improve management, help workplaces work better. And one of the big things come out in the chat, I suppose it might be my final contribution, I guess, one of the big points come out in the chat is the one we're grappling with, and others have grappled with too, and I know that people here would have grappled with in thinking about policy too. What can we actually do to affect workplace practice through public policy in this space? And I don't think that's straightforward, but there are some comments in there. Rachel Suffson from the CIPD, I noticed, and CIPD has done some really good work over the years on trying to improve HR management practices in small firms. We're currently doing some pilots around that as well, government-funded pilots around that. And I think there is a point about, we do have to build the sort of support services firms can use, and then we have to have a real focus locally and within industries on how we then make it worth people's while, and potentially look at ways to incentivize or firms to engage or even penalise them where they don't. And that's where I think actually Zubaida's last point there as well is important too. It's not just about the transparency, it's then about having consequences. What is your plan? And if part of your plan is we're going to engage with those sorts of services, that could, that having those services there could help to make a difference. But there's lots of things we could do. I think it's struggling to understand which ones would work, because we haven't looked at this in enough detail for too long.
Right, thank you. Okay, well, I'm conscious of time. We've had loads of questions in the chat. I know we've not been able to get to all of them, but thank you everyone who's put them in there. And as I say, this is part of our Commission for Healthier Working Lives, and the Secretariat have been kind of watching and really paying attention to the questions and also the sort of responses and solutions people are offering. So I think really just to wrap up then in the sort of final minutes, first of all, to thank our speakers and our panel. I think a really interesting discussion, particularly like the way we got into a bit of back and forth on a few issues, which I think highlights the fact that there's a lot of debate to have on this. I think I felt that across the board, people are seeing that there is an opportunity for change at the moment. We've got a government who's putting this issue sort of fairly high on its agenda, and so an opportunity to see policies coming through that are going to help. I think one of the things that came through to me is this whole question of capacity in the system, and that coming through in a number of ways. So kind of capacity of management in this system, whether it's NHS and social care or no doubt other sectors, capacity for enforcement. So can we actually, if we've got legislation there, is the capacity there in the system to ensure that enforcement can happen? And then other organisations, we talked about the Health and Safety Executive, but there will be others too, where, organisations that clearly can have a role around some of these things, do they have the capacity to fulfil those roles? Transparency being something that kind of can certainly help shine a light on the problem, but without the follow through of action and action plans, not enough on its own. And I think, we're also recognising that we do need to address these gaps in the safety net for people, the financial safety net, because fundamentally, people with poorest health, people generally with poorest incomes, poorest safety net, and it's a kind of vicious cycle between poor health and low income and so on. And that's what we need to break if we're really going to be improving the health and productivity of working age people. So thank you very much. Please do, thanks for coming and joining this webinar. And to people, please do follow the further work that we'll be doing for our Commission for Healthier Working Lives, which will report next spring. Thank you very much.
Thanks, Jo.
Thank you. Bye.